mynews.studio.
Picture this. A mother checks her mailbox, expecting a bill, but instead finds a letter saying her years of medical debt are gone. North Carolina is trying something new. Could this change how we all deal with healthcare costs?
It's January 28, 2026. Let's dive in. North Carolina just cleared between $4 and $6.5 billion in medical debt for up to 2.5 million people. That number is correct. How did the state pull this off without spending its own money?
This is a first. The state used federal Medicaid funds through a program called Healthcare Access and Stabilization Program, or HASP. Instead of simply expanding Medicaid, they made a deal with all 99 eligible hospitals. If you forgive uncollectible medical debt for low and moderate income patients, you get enhanced Medicaid payments.
So hospitals only get more funding if they agree to wipe out the debt? How does that work in practice?
Right. The hospitals had to give up the debt as a condition for these payments. Nonprofits like Undo Medical Debt then purchased those debts, sometimes for just a few cents on the dollar, and completely forgave them. Patients didn't have to do anything. No tax consequences, just a letter in the mail.
Who actually qualifies for this debt relief? Is it only people on Medicaid?
It's broader than that. Anyone who has been on Medicaid since January 2014 qualifies, but also people up to 350% of the federal poverty level, or anyone whose medical debt is more than 5% of their income. For a family of 4, that can mean earnings as high as $105,000.
That's a lot of people. But why would hospitals go along with this? Is it just about the money?
The enhanced payments are substantial. $4 billion in 2024 and up to $6.5 billion next year. For hospitals, it turns bad debt into money for infrastructure or daily operations. Plus, they no longer have to chase payments from people who can't pay, which saves a lot of time and resources.
What about new debt? Is this just a one-time fix, or are there new protections for patients going forward?
There are new rules coming. Starting in July 2025, hospitals have to automatically check if patients under 300% of the poverty line qualify for help. Full discounts if you're under 200%, 75% off if you're between 200 and 250%, and half off up to 300%. Repayment plans can't last more than 3 years or take more than 5% of your monthly income. Interest rates are capped at 3%. Hospitals can't sell this kind of debt to collectors, and they're barred from using aggressive tactics. No wage garnishments, and definitely no jail.
That's a pretty big change. Who's making sure hospitals actually follow through?
The state's Department of Health and Human Services is requiring hospitals to report on their progress through 2026. If they miss deadlines, they could lose the extra Medicaid payments.
Any signs yet of how this is playing out? Are people seeing fewer bankruptcies? Or maybe improved credit scores?
It's still early, but so far, over $6.5 billion in medical debt has been wiped out. The governor says a third year of funding is already secured. Hospitals are seeing fewer aggressive collections. The state is tracking overall relief and financial trends, but more detailed data on bankruptcies and credit scores should come as the program continues.
Do you think other states will try this? What happens if the federal funding goes away?
That's the main uncertainty. North Carolina is the first state to link Medicaid payments directly to debt cancellation and prevention. Other states are watching closely, but if federal support is cut, hospitals might pull back. The hope is that this becomes a model. Both hospitals and patients gain, and the system as a whole becomes less punishing.
Stepping back, medical debt isn't just a U.S. issue. Could this kind of model work in other countries?
The basic idea, using public funding to relieve and prevent medical debt, could be adapted anywhere that debt blocks access to care. The key is linking funding to better access and fairness.
So, to recap, North Carolina worked with hospitals and nonprofits, used federal Medicaid money, and erased billions in medical debt for millions of people. The new rules make it much harder for future debt to trap families. The model could spread if the funding and political momentum last.
And for families in North Carolina, That means getting a letter in the mail that brings relief instead of another bill.
Thanks for listening. This episode was brought to you by mynews.studio. Try it free today.